Hi everyone, my name is Dr. Zoe Pradar from the Lung and Particle Research Group at Cardiff University. I'm sorry that I can't actually be there with you guys today, but hopefully this screencast will do the job. So today I'm going to give you a talk about the advances in vitro alternatives, and which is paving the way in 21st century toxicology. So a brief overview about what I'm going to talk about today. So first of all, we're going to talk about alternative methods at the forefront of scientific research, and that this is because the animal models are continuing to fail us in toxicological and pharmaceutical research. So I'm going to give you a brief overview about traditional lung toxicology, which is where the focus of my research is, and further to that use the NHPE models as an example of replacement models. And at the end I'm just going to give you some information that you can actually use as resources to help you out in your alternatives research. So do we actually need alternatives? Many would argue that we've been using animals for centuries and they seem to do the job okay. Why should we change now? They've been accepted into regulatory bodies. Surely we just stick with what we know. However, this is not really the case, as animal models are continuing to fail us as a society, and I think we need to look at alternatives and we need to change our way of thinking. Now, in 2007, the National Research Council published a report entitled Toxicity Testing in the 21st Century, a Vision and a Strategy. Now, in here it states that toxicity testing is actually approaching a scientific pivot point, and it's poised to take advantage of the revolutions in biology and biotechnology. Now, I see a statement like that, and I am glad that I'm one of the growing number of researchers who are on the 3R side of the fulcrum, and I'm getting ready to tip us into the future. And I think this is the way forward. Now, a little bit of information about changes in legislation that have spearheaded some of these changes to acceptance of alternative methods by regulatory authorities. One such amendment is the 7th Amendment to the EU Directive, which has actually placed a ban on the testing and marketing of cosmetic products and their ingredients on animals, and this ban took effect in March of this year. Now, we've also got the REACH, which is the Registration, Evaluation, Authorization and Restriction of Chemicals. This is in the EU again, and it came into force in 2007. And this has required manufacturers and importers to collate information on all chemicals sold in the EU in annual quantities of more than 1 ton, and they need to register their information with toxicity data in a central database run by the European Chemicals Agency, or ECHA, and this needs to be done by 2018. And basically, within the REACH legislation, they actually say that alternatives to animal testing are strongly promoted, and that animal testing must only be undertaken as a last resort. Now, not really a legislative change, but the public law in 1993, the Plan for Use of Animals in Research, stated that the National Institute of Health in the US needs to conduct or support research into 3Rs. Further to this, the ICFAM Authorization Act of 2000. Now, ICFAM is the Interagency Coordinating Committee on the Validation of Alternative Methods. What they want to do is to increase the efficiency and effectiveness of test method review, to eliminate unnecessary duplicative efforts, which is to minimize animal testing. They want to find new alternative replacement tests, and they need to test these methods and validate them and ensure that they meet the needs of the regulatory authorities. Now, more recently in Israel in 2010, a legislation was passed which actually came into effect in January this year, and again this is a ban on the testing and marketing of cosmetic products or their ingredients on animals, and is actually in line with the EU directive. Much more recently, the Drug Controller General of India in June 2013 also stated there would be a ban on cosmetics testing and their ingredients on animals. So this shows the way the world is actually going, and we need to move with it. So let's talk a little bit about the failings of animal models. But before we do that, I actually just want to talk to you a little bit about science and scientists. Now, I think One of the great things about being a scientist, or about scientists, is their curiosity and determination to be the best, to get the best possible results in their experiments with the smallest error bars and the best reproducibility. However, I believe that as life scientists, some of us have the tendency to drift away from this aim of perfection, and we want to justify it by the fact that life science isn't like mathematics. It's not always neat and tidy and perfect. And I'm not saying that's not true, but I think we're giving up too easily. So let's think about maths or physical science for a minute. As you were probably told in school, you can't get the square root of a negative number. It's impossible. And indeed, for centuries, mathematicians thought it was impossible to do and accepted this, and just used other things. And that was until Raphael Bombelli challenged this, and he thought, but what if we could take the square root of a negative number? Now in his work, this led him to define a negative square root as an imaginary number, or I. This simple solution has enabled scientists to apply I to open up the world of complex numbers, and has led to many advances such as alternating currents, relativity theory, fluid dynamics, quantum mechanics, and even, in biology, such things as the analysis of firing events in neurons. So I think we need to take a step back and take a look at ourselves and take a leaf out of the mathematician's book, and let's strive for that perfect, elegant proof, and not accept alternative methods as our impossible square root of negative numbers that we shouldn't even try to solve. Let's find our I. Let's make those alternative methods better than any methods we have out there today. So here's just some data to prove the failings of animal models in research. As many of us are aware, there is a high attrition rate of new pharmaceutical compounds. Now this means around 60% of compounds that enter phase 2 of clinical trials actually fail during this stage. Further on from this, of those compounds that do succeed at phase 2, a further 45% entering phase 3 fail at this stage. That's almost half. And even further to this, once compounds have actually been registered, around 25%, or 1 in 4 compounds actually fail after registration. This is showing a massive failing in the animal models that we're using to try and predict human toxicity endpoints. In another report, Olson and colleagues published in 2000 a survey involving data from around 12 pharmaceutical companies involving about 150 compounds and 220 human toxicity events. And what they deduced was that the ability of animals to predict human toxicity was around 70% if you took into consideration all possible animal models, and that was taking into account the best case scenario, whereby if one animal model predicted the human toxicity event, it was deemed a success. Now this isn't accurate enough in my eyes. Also, if we actually take a closer look and break down these animal models and look at rodents actually only managed to predict human toxicity in around 40% of cases. This is quite worrying considering that rodents are one of the most widely used animal models in scientific research, and especially in lung research, which is where my area is. So, beside from the fact that these animals are failing to predict human toxicity and we're not getting the results that we should, we have to take into fact the economic cost of this. So a total development for new compounds can take up to 12 years and can cost around $800 million. That's a staggering amount of money, time and resource that's being spent on things that are failing us, and we need to do something about it. Further to this, we know that adverse drug reactions actually happen a lot. In the EU, almost 200,000 people are killed annually, and this is upwards of 100,000 as well in the US. And according to India's Tribune newspaper, at least 1,725 people died in drug trials between 2000 and 2011. So essentially, due to failures of animal models to predict human toxicity events, we are actually using humans in clinical trials as our guinea pigs, and this is not acceptable. We've all heard of the thalidomide tragedy in the 1950s and early 60s, where more than 10,000 children in 46 countries were born with limb abnormalities and deformities. But that wasn't the end of the story. Almost half of these children actually died and didn't actually survive. Since then, numerous drugs have been withdrawn from the market due to serious adverse drug reactions. Now, I've just given you 3 examples, and I tell you the list is massive. For instance, the diet pill Redux was actually approved in 96 but removed in 97 after it was suspected to cause around 123 deaths. The blood pressure medication Porcicor was actually removed and it was suspected to cause around 100 deaths, and the diabetes drug Resulin was actually removed as it was thought to have caused around 390 deaths. Now here we've just got some companies who are actually striving to promote non-animal based tests, and all of these companies here test all of their products on non-animal based tests. For instance, Waitrose and the John Lewis partnership do not test any of their own brand household products such as laundry detergents and cleaning products, or even their cosmetics, toiletries or personal care products, or their ingredients on animals. And Lush are actually at the forefront of pushing for non-animal based tests, and they actually have never tested any of their cosmetic products or ingredients on animals since the inception of the company in 1994. And although many companies state that they use non-animal tests, they say they actually do only use animal tests where regulatory laws require them to do so in that country. Now, Lush have taken this a step further, and they have actually refused to trade in these countries that demand animal tests on their product by law, and they're actively campaigning with these countries to demonstrate that non-animal tests are perfectly acceptable, and they've even taken an active role in supporting scientists by offering the Lush Prize every year. Okay, so let's look at some traditional toxicology in terms of lung research. So traditionally, research has been undertaken on rodents where particles need to be instilled or inhaled by the rodents. Generally, the rodents are then euthanized. They do bronchiolar lavages to remove proteins and cells. They remove the lungs, they embed the tissue, do microscopy analysis. We take their results, and these then need to be extrapolated to the human response. Let's take a closer look at rodents. So first of all, they have different anatomy and physiology than humans. This is as basic as branching patterns in the airway are different, to cell types and composition of the airways, and sips differing in the airways as well. Also, they are nose-only breathers, whereas humans use both nose and mouth, which affects particle deposition. You need to use unnecessarily high doses, and then obviously we need to extrapolate that data to human events, and that's not always reliable enough. Let's look at the cost benefits. This is just a simple experiment whereby you're using n equals 6 rats per group and n equals 30 per time point. And if you look at an acute and a chronic exposure system, an acute one costs around £10,000 for a week, whereas a chronic exposure costs around £126,000 a year. Let's compare this to the NHBE model, which is our in vitro model of the respiratory epithelium. We can get around 360 cell culture inserts per donor cryovial, which is about 500,000 cells, and this can be generated for a cost of around £2,500, which is massively cheaper than animal experiments. So just on a purely economic standpoint, it makes sense. So just a brief overview of some of the benefits of using in vitro models over animals. So let's have a look at some in vitro lung models. Now, many respiratory researchers use cell line models such as CalU3, BAS2Bs and the 16HBs. And they do this because they're relatively easy to work with and cheap to obtain. And obviously one of the major pros of these cell lines is the fact that they are immortalized. Now, if we look at some of the cons of these models, they're actually quite significant in important features of a bronchial epithelium, such as variation or problems with tight junction formation. They have metabolic deficiencies, they lack mucin or functional cilia. These are all quite integral parts to a functioning bronchial epithelium, and I think we can do better in terms of in vitro models. And that led us to develop the NHBE model. Now, the NHBE model uses human bronchial epithelium cells taken from post-mortem donors. Now, these can be obtained either commercially through companies such as Lonza, or they can be obtained through links with hospitals as long as the necessary Human Tissue Act regulations are actually followed. Now, what we do with these cells is we initially subculture them in flasks before seeding them into millipore cell culture inserts, where they're grown at an air-liquid interface. Now, this air-liquid interface is actually essential to produce the differentiation required in the NHB model. Once the model is fully differentiated, you can then undertake your testing and analysis, and pretty much any kind of test you would want to do on tissue you can actually do with the NHB model. So why do we think the NHB model is actually a good model? Well, for starters, it forms a pseudostratified mucociliary epithelium with a high number of differentiated cell types, such as ciliated, goblet, clara, serous, intermediate and basal. They also form functional tight junctions, as well as adherence junctions and desmosomes. They express cytokines, and the cytokine profile can change when they are exposed to external stimuli. They do also secrete mucin, which does actually need to be removed every couple of days, and obviously being of primary nature, they do not contain any cancerous or transfected genes as cell lines do. Now, obviously one of the major limitations of a primary cell culture model is the limited lifespan compared to immortalized cell lines. However, much research is being done in this area to try and improve the lifespan of such cultures. Now let's take a look at the morphology of the NHB model. As you can see on the top here, we've got a semi-thin section stained with tall blue, and you can clearly see that the NHB model is a pseudostratified mucociliary epithelium that is reflective of the human in vivo situation. On the bottom left here, we can see an SEM of the surface topography of the cultures, and you can clearly see here again the cilia present, the mucin secreted, and again the resemblance to the human in vivo situation. On the bottom right, you can see here a close-up image of the apical region of a ciliated cell. This is a TEM image. You can see the cilia here. We can see the anchoring basal bodies, and if you take a section through the cilia, you can actually see the 9+2 axoneme formation, proving that the cilia are actually functional, and if you actually look down a phase contrast microscope, you can actually see the cilia beat. Again, like I said, they contain all relevant secretions such as mucin and glycocalyx production, and contain functional junctions. We can see here a TEM image depicting tight junctions, adherence junctions, and desmosomes. We also looked at tight junction proteins like ZO1 and occludin, where they form these nice networks around the cell periphery. So one of the developments of the NHB model is to actually build in some metabolism. Now, the reason for this was numerous pharmaceutical companies actually wanted to get metabolism in vitro into the system. They wanted to know what would be the consequence of inhaled compounds in terms of their metabolites. So in order to achieve this, we took the NHB model and we actually co-cultured them with primary human hepatocytes to create our metabolome. Now basically what you need to do is you put your compound on the surface of the epithelium. These compounds will then potentially migrate through the epithelium, whereby they will come into contact with the hepatocytes and be metabolized. You can then see the effect of the metabolites on both the hepatocytes themselves and also back on the bronchial epithelium. So let's just take a quick look at some of the data we've produced through the metabolome. This is looking at phenacetin and its metabolite acetaminophen, which was detected via HPLC. Now we can see here when phenacetin was put with hepatocytes alone, we get quite a large amount of acetaminophen produced. When we look at the NHBE cells alone, we can see that there's no real detectable metabolism of phenacetin. However, if we look at the co-culture, we see that there is actually metabolism in the co-culture model. Now you may argue that this is much less than in the hepatocytes alone. However, you have to take into consideration the fact that with the hepatocytes alone, the primary compound is put directly into the culture media with hepatocytes, whereas with the co-culture, the compound is placed on the apical surface of the NHBE cells. It then needs to migrate through the epithelium before it comes into contact with the hepatocytes, whereby it can be metabolized. We can also see similar results for CYP2D6, which is dextromethorphan, and its metabolite dextrorphan, and again with CYP3A4 activity. Now just a few information points for you if you wanted to do some more reading around alternative methods and wanted to know the kind of resources that are available to you. Here are just some of the resources you can actually, or websites you can actually look into and tap into. So here we've got CAT, which is the Center for Alternatives to Animal Testing. This is based in the US, but they also have a sister organisation in Europe called CAT Europe, and that forms links between the US and Europe. Now they've got a lot of information on their website, and it's a great resource to use. They have web links and seminars and talks and an online course, and they also produce this here called AltWeb, which is a great gateway for alternative news, information and resources. It has great publication highlights and a calendar of workshops and conferences in alternatives. You've also got a couple of other ones here like the IIVS, who run great training courses and have great resources, and you can even send them your products for them to do in vitro testing on. Accelerate here as well. This is another great website that offers great courses and training and standard operating procedures for you. You've also got In Vitro Jobs, which is a great portal for those looking for jobs out there in alternative methods, and it even gives you a list of research groups practicing alternative methods if you want to contact them separately. AltTox here as well have got a great online forum where you can ask for help. They've got a great toxicity testing resource which has a great table on the alternative methods available and whether they've been validated and approved by which regulatory authorities. We've got the NC3Rs here which offer funding, and they also do a 3Rs prize for a paper published in the last year on alternative methods. In Latin America you've also got RENEMA and BRACFAM. Again, conferences are a great way to gain information. You've got some big ones coming up this year, the World Forum on Biology in the US. You've got the 9th World Congress on Alternatives in Animal Use in the Life Sciences, which will be held in Prague. You've also got the European Society of Toxicology in Vitro, which will be in the Netherlands this year. You've got BioLatam, you've got CIFARP, and you've got the Society of Toxicology annual meetings. You also have numerous dedicated journals such as Altex, ATLA, In Vitro Cellular and Developmental Biology, and Perspectives in Laboratory Animal Science and Toxicology in Vitro. Many of these are open access. So in conclusion, we just want to say that toxicity testing is actually approaching that scientific pivot point, and we need to decide which side you want to be on. And we have consistently seen that animal models are failing to accurately predict human toxicological endpoints. And further to this, we need to therefore develop alternative models that will accurately reflect the human in vivo situation to allow us to produce better, safer drugs in a more economic and timely fashion. And also that there are numerous resources, societies, conferences, training opportunities, workshops, funding streams and jobs available to those pursuing the 3Rs. just want to say thank you very much for inviting me. Thank you to Nick and Mario. Here's my email if you do have any questions, and hopefully I'll meet you at a conference soon. Thank you.